Okay, chapter 7 is about immunity. And for your body immunity means your ability to resist immunity. It can be non-specific and it can be specific. And I think I talked about this a little bit before. Non-specific and specific. Something like your skin, for example. Mucous membrane. Body secretions. Any one of those is non-specific, meaning it blocks anything. Does it block the bacteria, protozoa, virus, anything? That's non-specific. Specific means it's going to work against something specifically. Like this, lymphocytes work on the flu virus only. This one work on the hepatitis only. And this will be called specific. So specific and non-specific defense. Non-specific work against anything. Specific is working against something specifically. These are the components of your immune system: lymph nodes, spleen, tonsils, lymphoid tissues, and so on. And we have immune cells, which are lymphocytes and macrophages. Immune system will develop in the bone marrow or the thymus. The maturation occurs in the thymus. And we will talk specifically about the lymphocytes. What's antigen and what's antibodies? Antigen. Antigen is a protein on the cell membrane itself. So this is a cell membrane, and there is a protein like this on the top of it that tells the body who you are. It can be on the cell, it can be on anything, even in a bacteria, protozoa. So antigen is HLA, and we will talk about this. It's a type of protein that define the cell. This is exactly, I say it like the antigen is like this. Like when there is a mail delivery for you, DC 23777 Harper Street or something, right? This address, tell them who you are, right? This is the antigen. You have something similar to that. It's a protein on the wall outside that tells your immune system who you are. And this antigen can be self or non-self. Self means your own cells. Your own cells. Each one have a specific antigen. And your immune system already know. So here's the immune system going around like this. Okay, let me see this antigen. Yeah, I know this antigen. This is a liver cell. I know what it is by looking at the antigen. Go around, this is the skin cell. How did you know? I look at this antigen, I remember it. Okay? A bacteria is coming from outside. Let me look. Oh, this antigen is not something in my memory. I don't know what it is. This is not self. I need to attack. Right? So it can be self, it can be non-self. Usually they are in the outer surface or the cell membrane. And for the immune system, we have the macrophage. Where the macrophage, they come from what? Monocytes. They come from monocytes. What about the micro? Neutrophils. So the macrophages are one of the non-specific. They are the ones, the first responders. These are the non-specific first responders. What do you mean non-specific? Means they eat anything. Not specifically? No. Bacteria, virus, protozoa, anything. If they found something, they will eat it, non-specifically. And this is your first line. So macrophage to me is something like these police cars going around all the time, right? Police cars, and this is the first responder, right? Most likely you don't go directly to drug administration, something in the police department. You don't go to specific. These cars are going around all the time. So here's a fight. They stop. You cross the red line or the red light. They stop you. Somebody looks suspicious. They go to him, right? So they are going around first responders. This is exactly like the macrophage. The macrophage is not specific, and this is the first thing to respond. And when they respond, they are going to present to the other types. So I'm a macrophage, I'm going around. Okay, I'm not specific, anything. I see here antigen. What is this? This is bacteria. Okay, let me eat the bacteria, some of them, and then I will tell the rest of the immune system, you need to come here. There's an infection. I want to introduce this to you, present it to you. And this is called the antigen presenting cells, the first responders, macrophages. They are the first to respond. They present it to you, to the cells. They tell the cells, I found this, and it looks like hepatitis. I'm presenting it to you, take care of it. I ate some of it, phages, I ate some of it, and you need to take care of it. And that's why they call it the presenting cells. In order to call for the other cells to come, they produce something called the kines. Kines, okay? Monokines and other types of kines. Kines means something that move, chemicals that attract other cells. Lymphocytes, on the other hand, these are the specific ones. So the lymphocytes are specific. This lymphocyte, specific for hepatitis virus only. There is a flu virus, not my job. There is another lymphocyte that's responsible for it. Is that the case for the macrophage? No, the macrophage eat anything. That's bad, right? And the lymphocytes are called T or B. T is the first letter of thymus because they are maturated in the thymus, not produced, maturated. We have two types of lymphocytes. Both of them are produced in the bone marrow. B and T, both of them. B is maturated in the bone marrow, and this is where the name came from. The first letter of bone marrow is B. B lymphocyte, produced and maturated in the bone marrow. This is where the name came from. How about the T lymphocytes? Produced in the bone marrow, but activated or maturated in the thymus. Are we following so far? Did you get the difference? Why did you call it T, the first letter of thymus? Is that where it's produced? No. This is where they are maturated. How about the B? Produced in the bone marrow, maturated in the bone marrow mainly. And these are responsible for cell-mediated immunity. The B lymphocytes are responsible for antibody or humoral immunity. What does that mean? It means like this. I'm the T lymphocyte, okay? I will go, right? Physically interact with this person, fighting him physically, person to person, cell-mediated, me, myself. The B lymphocytes, on the other hand, they don't do that. They stay away and they shoot antibodies from far away. They do not engage individually, physically. Did you get the difference? Cell-mediated versus antibody-mediated. You fight by yourself as a cell, cell-mediated, T lymphocyte. If you fight by producing antibodies, and the antibodies goes to the antigen, react, kill, this is the antibody-mediated, also known as humoral. Humoral antibody-mediated is the same thing. There are different types of lymphocytes. There are cytotoxic or killers, helpers, and memory. Cytotoxics or killers, these are cytotoxics. Cytotoxic, toxic to the cells. They kill the cells. And these are the ones that I'm talking about. There are two additional types, helper. Helper, they help. And this is where the name came from. They help T and B. They help both of them. If you don't have it, you lose both types of immunity. You lose both cell-mediated and antibody-mediated. Are we following? Did you get what I mean? Okay, then the last one is called the memory T cells. What are the memory T cells? Here is the memory. Here is infection coming to the body for the very first time. Okay? Macrophage go, what is this? Let me discover, let me find out. And then it will tell me, I'm the lymphocytes. Okay? I found this, I tried to eat as much as possible, and I found out that this is TB. You need to come and fight. Who is responsible for TB? Okay, here I come. What is this? TB. Okay? Okay, I want the other T lymphocytes to come, engage, kill physically. B lymphocytes produce the antibodies. You get rid of the bacteria. Is everything okay? Everything is fine. Okay, we cleared? No, that's not enough. I'm going to leave some of the T and B lymphocytes that were engaged in this fight, stay aside. So if something like that to happen again, you remember it right away. Instead of taking time to recognize, because it takes time. What is this? I don't know. Let me see. This is this virus. Let me discover the antigen. Let me find out what it is. Let me do the analysis. Let me make some antibodies. Let me do this and that. Takes time, right? But after you get the disease, the second exposure, you have memory cells. Memory T and B. Both of them, they know what is this. So there are memory cells for each disease. And depending on the amount, on the type, there are different lifespan for the memory cells. Let me give you this example. How many times do you take the hepatitis vaccine? 3 times? You don't take it 1 time, right? Why? And why in these specific dates? This is the lifespan of the memory cells, basically. You take it after birth, you take it after a year, you take it after 10 years. Why? Because this is the lifespan of the memory cells, after which the memory cells are gone. So if hepatitis come again, this is as if you never heard about it. How about this? Measles. How many times do you take it?
Twice. Or measles once.
Once.
I had it twice. They said
I
that.
thought it was.
I had it.
How about if you got infected? Measles, they might activate the vaccine, but how about the disease itself? How many times can you get infected?
One time.
1 time. Usually the measles is 1 vaccine or 1 time. Sometimes you do activation for more protection, but how many times can a child get measles? Once in your lifetime. Why? Because memory cells stay for life. Lifespan for memory cells for measles is for life. Okay? And actually, in some people, they say, okay, this person is having measles, let me get my child in contact with him, so he get the measles and he doesn't get infected again. And this is weird. Some people think like that, but it's not right. But the point is, memory cells, B and T, both of them will survive for the entire life. Something like flu, the lifespan of the memory cells is very short. You can get flu today, you can get the same thing next month. Okay? This is for the memory cells. And that explains why the first exposure, first time you're exposed to infection, it takes you time to compact the disease, to get rid of the disease, but the second exposure is usually shorter. Why? Because once the virus comes, oh, I remember you. I have the memory cells. We're ready for you. We've been waiting for you. Kill. The first time is longer. So that's why the body reaction in the primary infection is a lot longer than the secondary infection. B cells, it's antibody mediated, also called humoral. Why did you call it B? Produced and activated in the bone marrow. Here is one point. The T lymphocytes, cytotoxic, they kill, produced, and they go and fight. B cells, they do not produce antibodies right away. They have to maturate and become plasma cells first. And plasma cells are the ones that produce the antibodies. So the B cells, are these antibody mediated? They are. They produce antibodies? Yes. But only after being activated and maturated and become plasma cells. Did you get the idea? B cells, the mature form is plasma cells, right? So we have 2 types of immunity, humoral cells. Which type? Which lymphocytes? B. And cell-mediated? T. What's the other name for humoral? Antibody-mediated. Humoral is the same as antibody-mediated. Here is the development. Both of them come from the bone marrow, but their maturation is different. All right? Did you get this point? So this is how they are maturated. They go from stage to stage. Not the most important thing. You can read it. Now, the antibodies. What are the types of antibodies that can be produced? I want you to know one thing about each one of those. Okay? Write it down, memorize it. These are the types, M, A, G, E, and D. M, A, G, E, D. And I will tell you how I remember it. M This is how I remember it. Momentum. Momentarily. These are the first one to appear. The first one to be produced are M. Okay? These are the first one to be produced. M, momentarily. This is how you remember it. Remember it your own way. But you have to remember this. What's the first type of antibiotic that's antibodies that's produced? M. How about A? Surface and secretion. Surface and secretion. Something like sweat, sebaceous secretions, tears, breast milk. These are all secretions. If I ask what's the breast milk contain, you tell me A. Saliva, A. Tears, A. Why? It's secretion. Surface and secretion. This is for A. G for great. I'm making that up just to remember it. Great amount. This is the largest amount that's produced. Right? E for allergy and inflammation. D is not the most important one. It's just for recognition, for attachment and activation of B cells. Okay? Did you get this? Memorize this. M, momentum or momentarily. They are the first to be produced. G is for great, great amount. The largest amount to be produced. A, two S's, surface secretion. E, allergy inflammation. B, just helpers. They activate the B lymphocytes. These are the different types, major components of the immune and the function, but I would focus on the following. If I do blood test for you, and you're saying that you have leukopenia, what should I assume? What type of infection? Viral. If you have leukocytosis, what should I assume? Bacterial. Now, here's the second step. I don't need only to know if the white blood cells in general are increased or decreased. I want you to tell me specifically the numbers of each one, which is called the differential count. What's the importance of that? Here's the importance. If I did a differential count and I find the neutrophils increased, this will tell me that you have some sort of inflammation and there is some sort of phagocytosis. If you have a lot of eosinophils, I can tell that you have some sort of allergy, for example. You have some sort of allergy, something producing allergy for eosinophils. Basophils, it's more for eosinophils, I mean for allergy and parasites. This is what you need to remember, okay? If you have leukocytosis, tell me exactly what it is. Eosinophils. Eosinophils are too much. What should I expect? I will tell you. You have either allergy or parasite infection. Just by knowing which type is high. Okay? Neutrophils is generally speaking for any inflammatory process. Basophils for also inflammation and sometimes anaphylaxis. Okay, and we'll talk about the rest, but this is the most important of all. What if you find a lot of eosinophils? What should you expect? Neutrophils, what should you expect? Basophils, what should you expect? And so on, okay? There is a system inside our body that's called the complement system, and this is a system that's complementing, and this is where the name came from, complementing the function of the immune system, complementing it, okay? These are types of proteins. They call it complement 1, 2, 3, 4, until 9. It's a protein that complements the function of the immune system. Okay, did you get this? It complements the function of the immune system. How? By damaging the cells that need to be damaged. There are different types of chemical mediators. Most important of all is histamine and interleukin. Histamine is something for vasodilation. It vasodilates. Remember when we talked about inflammation in the very, very beginning? The blood vessel dilate and so on. So histamine is for vasodilation. And that's why, what do you take if you have like congested nose? You take antihistaminic, right? Why? Because the histamine is causing the blood vessels to dilate, blocking your nose. Okay, so you can take decongestant like drops or antihistaminic medication. Interleukin, inter means in between, leukins means white cells. This is the communication between different types of white blood cells. There are different types of tests. There is the body titer or titer, and this is basically measurement of the antibodies, which is the same as immunoglobulins. Immunoglobulins is the same as antibodies. This is called the body titer. So if I wanted to know if this person is having hepatitis or not, this is the first thing to do. The body titer. I take a blood sample and I see how much antibodies do you have and which type. Okay. My second step will be doing ELISA. Okay, which is another thing more specific to detect the antibodies against HIV specifically. Okay. MHC typing. MHC is major histocompatibility complex, and this is histocompatibility. Histo means tissue, right? Do you know that? Histology is studying the tissues. So histocompatibility, it tells us, it's a complex on the tissues that tells us are these tissues compatible or not. Like you need a kidney, and this person is a donor. I can't just give it to you. Give me the kidney, I will do the MHC, and I'll see if it's compatible or not. There is a complex on your kidney, another complex on his kidney. I will see if it is compatible or not. Measure histocompatibility antigen. Immunity can be natural, innate, and there is always a primary and secondary exposure. Which one goes faster? Primary or the secondary? The first time you're exposed to the disease or the second time? So secondary is faster. And immunity can be one of the following. And let me just explain this all together so we don't take the time. Just understand it and you will get it. Any question in this part, you will get it by this way. You are forming immunity, which is your defense against something. You either make an effort to make it, or you don't make an effort. Can you get immunity against something without making an effort? Yes. Like this baby is taking the antibodies from his mom. Did he make any effort? No. Right? Get it from the breast milk. Did he make any effort? No. This is called passive. If you make an effort to produce it, this is called active. This is the first part. Did you get this? So the first component is it active, is it passive? How to tell? Did you make an effort or not? This is one. Number two, is it natural or artificial? Natural is something like this. You got sick. Is that natural or artificial? It's natural, you got sick, right? Artificial is something that you intentionally do. Did you intentionally get sick? Of course not, right? So when you see any one of these, you need to go as follows. Is it active? Is it passive? Is it natural? Is it artificial? So let me give you examples and tell me what you think. Vaccination. It's artificial, right? Are you like walking and somebody like accidentally, right? Put the needle in your arm accidentally or something? Or you go to the doctor and he give it to you. It's artificially, right? It's induced. So this is artificial. Is it active or passive?
It's active.
It's active. You know why? What's the vaccine? The vaccine is either a weak or killed virus introduced to your body. The macrophage will come. You will make an effort. Don't you see that there is always some sort of inflammation, get red and swollen? So are you fighting it? Yes. What's the rationale behind that? I give you a weak vaccine or killed vaccine so that your macrophage will come and they will contact or call by interleukin. They call the T lymphocytes and B lymphocytes. You need to come. Here is a virus. It's dead, but there is on the top of the virus there is an antigen. So you have to work on it. And then you keep memory cells, and this is the rationale behind vaccination. Did you make an effort? Yes. Did your cells work? Yes. How about this? Breast milk. This is active or passive? Passive. Is it natural or artificial? Natural. How about intrauterine in the uterus? You get antibodies from the mom. Is that active or passive? Is it natural or artificial? Natural. How about this? You go to the hospital, you have infection, and you're not resisting much. You're not doing good. So I'm going to give you IV through a cannula and give you antibodies that's ready-made. Is that active or passive?
No, passive.
It's antibodies. What efforts are you doing? I'm giving you a gift. It's passive. I give you antibodies. What kind of effort did you do? It's passive. But is it artificial or natural?
Artificial.
Of course artificial. It's not natural to live. You're not living in a hospital and they give you on a daily basis, right? This is something artificial. See, these are the different scenarios that you can see. Any one of those four. And you always tell yourself, is it active, is it passive? Is it natural, is it artificial? Did you get this point? And this will cover a good part of this. And you can see any one of those as a question. When you do a tissue transplant, you should do the MHC anyway, the major histocompatibility antigen. If it is compatible, okay, go ahead and do the transplant. But if you have a rejection, what type of rejection? And it depends on when did you reject. If you rejected right away, immediately, hyperacute. I did the surgery and I'm watching you transplant, it's rejected, hyperacute. If it takes a couple of weeks, that will be acute. It takes months to years, so you did the transplant, everything is okay, and 5 months later, you're having a problem again. Let me see, oh, you got rejected. So this is called chronic or late. These are the different types of rejections that we need to know. Immunosuppression is something that suppresses the immunity. It can be in the form of infection or drugs. Most commonly, this, prednisone, which is cortisone. Do we know that cortisone suppresses the immunity? Cortisone, here's what you need to know about cortisone. When I write something here, write it down. It's important. I'm not just putting it here just because I wanted to write it or something. Here's what you need to know about cortisone. And, prednisone is one of the cortisones. Cortisone. What do we need to know about it? It's immunosuppressive. Anti-allergic. Strong anti-allergic. Anti-inflammatory. Strong. Did you get this? You have to remember this. Cortisone, immunosuppressive, strong anti-allergic, strong anti-inflammatory. So immunosuppressive is one of them here. And the problem is you will be in high risk for opportunistic infection. What opportunistic infection? Something that find the opportunity to invade you, like fungus. It's an opportunistic infection. It doesn't cause infection under normal circumstances, right? But it does if you have low immunity. Yes? Oh, okay. Hypersensitivity reactions. What hypersensitivity reaction means? You're hypersensitive. So everybody is having a standard sensitivity. All of us go to the backyard, and all of us are fine, except you. Or except two. You are hypersensitive. You go to the backyard, everybody in the class is fine, except two. Having some itching, having some redness, difficulty breathing or something, you are hypersensitive, meaning you have allergy. Okay? And hypersensitivity is different types. Type 1 is the allergic reaction, which is what I just mentioned. And what type of antibodies is produced in allergy? E. Don't forget this. Okay? So type 1 is the allergic reaction. You're exposed to something and you start to itch, something like pollens. You go to the backyard, you start to sneeze and cough and so on. The worst of all in the allergic reaction is anaphylaxis. If you heard about this, a bee sting. What happens to you if you have a bee sting, if you're normal? Pain, it's bad, you feel bad, and that's it, right? Some people have the EpiPen, right? Why? Because they have severe, not just hypersensitivity, severe hypersensitivity. If they don't take it, they will not be able to breathe, and they can get all the way to anaphylaxis. What do you need to know about the anaphylaxis? Severe allergic reaction that can go to the extent of difficulty breathing, severe hypotension. Did you get this part? Did you get this? Anaphylaxis. And that's why if this person is hypersensitive and he got the bee sting and he doesn't have the EpiPen, he can actually die. We know that, right? Anaphylaxis. And the example of that is allergic rhinitis, atopic dermatitis, and asthma. Anaphylaxis, like anaphylactic shock, I just mentioned it. Most important to remember is this and this. Constriction, bronchospasm, you cannot breathe, severe hypotension. There are a lot of signs for anaphylaxis, but I told you the most important: difficulty breathing and severe hypotension. Okay? You can read this, but treatment of anaphylaxis, somebody having anaphylaxis, of course it's EpiPen. If we know that this person, especially children, if you know that this is having this, he has to go around with the EpiPen and then call 911. You can get any one of these treatments: epinephrine, which is the EpiPen, glucocorticoids, anti-allergic, antihistaminic. Sometimes you need oxygen and stabilization of the blood pressure. Cytotoxic is type 2. And these are antigens that in the cell membrane, not antigen that's scattered, like the type 1. This is in the cell membrane, okay? And they will cause a reaction, something like incompatible blood transfusion. And the examples here are very important. Examples. So you need to know, type 2 is called cytotoxic. What's cytotoxic? Meaning the cell itself is toxic. Like you get blood cells from somebody else, blood transfusion. The cell of the person have an antigen that's incompatible with you. And you're going to react. And what happened to the blood? What happened to the blood of the donor if it's incompatible? How are you going to reject it? Kill it. Rupture. Break it down. Type 3 is immune complex. And immune complex means antigen with antibody. They come together. They settle down on something and they start the process. And again, the most important is examples. So immune complex example are glomerulonephritis and rheumatoid arthritis. Did you hear about rheumatoid arthritis? Rheumatoid arthritis happen specifically in the small joints. Antigen and antibody come to it, they react together, and this complex go to the joint and settle down there. Examples are very important to remember. Number 4 is cell-mediated or delayed hypersensitivity. And this is something like tuberculin test. What they tell you when they do the tuberculin test? They do the test for you and they tell you, come next week or something, right? It's not something like you go to the backyard in a few seconds and you get something. This is immediate, or type 1. This is delayed, okay? Which is sensitive T lymphocytes are going to come, release lymphokines until they destroy the antigen. And examples are very important: tuberculin, contact dermatitis, allergic skin rash. Autoimmune disease. What are the autoimmune disease? The name give it away. Auto means self. Autoimmune means against the immune system is fighting your own cells. How? As simple as this. I mentioned in the beginning that your immune system know every single antigen on your cells, right? Sometimes the immune system forgets. So like systemic lupus erythematosus, for example, or rheumatoid arthritis, or Hashimoto thyroiditis. What are these? Thyroiditis, allergic thyroiditis means the immune system remember every single antigen of every single cell except the thyroid cells. So it's going to fight your own thyroid cells. Rheumatoid arthritis, fighting this. Systemic lupus erythematosus, systemic, it's called systemic because the immune system forget about your skin, forget about your liver, forget about your blood vessels, Forget about systemic things, different things, and fight your own antigens, your own cells. And the examples here are important as well. Hashimoto thyroiditis, systemic lupus, rheumatic arthritis, these are the most important of all. Systemic lupus, here it is. Just give me a couple of minutes. Systemic lupus, it's different systems, and it affects the skin, the blood vessels. It's more in young women, something like this. Butterfly reaction, look at this. This is one off, this is the skin part of it. But if you see the blood vessels will be affected. Same thing. And these are the different diagnostic and treatments. Immune deficiency means you have something deficient, you have immune cells that are deficient, you don't have it, or it's really suppressed because of any problem. You have suppressed lymphoid tissues, you have splenectomy, and so on. AIDS, this is the last thing that we will talk about, and here's the most important thing to remember about AIDS, and we'll be done after that. AIDS, acquired immune deficiency disease. It's a chronic disease. Most important thing to remember. They attack your own T helper cells, also known as CD4 cells. Remember the helper cells? Helper cells help what? They help which cells? Both T and B. It helps both of them. So if these viruses kill the helpers, you don't have help for T and B. You don't do the function of T and B. You don't have the cell-mediated or the antibody-mediated, so anything can infect you. Anything can infect you. And there are certain things that I want you to remember regarding this. Some cancers, something like lymphoma, okay? AIDS virus, HIV virus is an RNA virus. You need to remember this. RNA virus. RNA virus. Okay? And there are certain diseases that come with this. Most important to remember is lymphoma. If it's not here, you have to remember it anyway. Okay? Lymphoma. Kaposi sarcoma. Kaposi sarcoma. K-A-P-O-S-I, Kaposi sarcoma. You need to know it. You will find it in your textbook, even if it's not here. Kaposi sarcoma, lymphoma. These are two special types of tumors, cancers that happen in AIDS patients. Pneumocystitis carinii. Pneumocystitis carinii. Pneumocystitis. P-N-E-O-C-Y-C-T-I-S, pneumocystitis carinii, C-A-R-N-I-I, two I's. Pneumocystitis carinii. P-N-E-U, M-O, cysts, C-Y-S-T-I-S, pneumocysts, and carinii is C-A-R-N-I-I, pneumocystitis carinii. Why I'm mentioning these? These are unique things. Normal people don't get it. This is a special infection that happens specifically in people with AIDS. And by the way, most likely they die with this weird name that I just mentioned. A lot of patients with AIDS, they die with this. Pneumocystitis carinii. Cause pneumonia, lethal pneumonia. Okay? History, you can read it, and that's it for this chapter.